Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide another quick answer to an important question. And this question is, isn't COVID-19 about the same as the common flu? Why do people think this? Well, they think it for two reasons. First, many of the symptoms of COVID-19 and the flu are basically the same, and it seems like they're spread in similar ways. These are people's perceptions. Are they true? Yes, in fact, many of the symptoms of COVID-19 are similar to those of the common flu: fever, cough, shortness of breath, fatigue, sore throat, runny nose, headache, though some are a little bit different, notably loss of taste or smell and the degree of serious illness. And also it appears that they spread about the same way, person to person, by droplets and aerosols, though there may be some difference in the spread from surfaces. Well, if these two things are true, should we conclude that COVID-19 is basically the same as the common flu? Well, let's look at some ways in which they are different. First of all, flu comes around every year, and this is the only year that we've had COVID-19. So it's a little bit hard to draw conclusions. But while both can be fatal, the level of lethality is quite different. This is the number of deaths each of the last 10 years in the United States, averaging just 36,000 deaths a year on average from the common flu, influenza, in the United States. Now, I've had to adjust the scale a little bit, but there we are again, the red line at 36,000. We estimate now that by the end of this year, there'll be 240,000, over 7 times more deaths from COVID-19 than from the last 10 years of the flu on average. 3/4 of all Americans die of one of 10 causes. Here they are. These are the number of deaths we would expect in a normal 8-month period. COVID-19 is 187,000 by the end of August, and flu and pneumonia combined are 37,000, again, about a fifth the number. The other reason they're different is the fact that they're caused by different viruses. They're just different diseases. Now, you may say, well, does that really matter? Yeah, think of the lion and the tiger, right? They do the same thing. They hunt, they eat prey and all of that, but they're very different animals, and no one would say that they're the same. So no, COVID-19 is not the same as the common flu. If you have any comments or questions, please let me know. I look forward to hearing from you. Thank you very much. Bye-bye.